Hi, thank you for joining us. I'm Dr. Diane Adrian from the Center for Autism and Related Disabilities, and we're going to be talking today about some of the challenges of students with autism in the classroom. Some of the common challenges that actually require school administrative support. They're not necessarily decisions a teacher by themselves can make. Some of the strategies that help foster positive relationships between home and school. And I'll be sharing some resources with you as well. So this topic frequently comes up. How common is autism spectrum disorder? So very recently this year, the CDC analyzed their data from their surveillance project and again increased the prevalence rate to 1 in 31 children. This is looking at the records of 8-year-olds. 1 in 31 children have autism spectrum disorder. We know that it occurs in all racial, ethnic, and social groups, and boys are 3 times more likely than girls to have ASD. So this last statement is an update from what we previously thought. We thought it was 4 times more likely to occur in boys. According to the current assessment, it's 3 times more likely in boys to occur. So that's a change. And a clinical diagnosis of autism requires for 2 main areas to be affected for someone to be diagnosed with autism. They have to have specific and several kinds of impairments under social communication and interaction. And they also have to have characteristics under restricted and repetitive behaviors. And their expressive language really can vary from nonverbal to minimally verbal to highly verbose and impressive sounding language. This is a change. So no longer is core language impairment required for someone to receive a clinical diagnosis of autism spectrum disorder. I know that school eligibility is different and really varies probably by state and district in terms of exactly what they qualify under autism spectrum disorder. Okay. But for our purposes, we're just going to be describing, I think, some of the challenges. This presentation is geared towards highly verbal people with autism who have probably an average to above average IQ, maybe a little bit of some borderline IQs as well. So we see that in autism, we have people who can have a severe intellectual disability all the way to having an IQ that's in the gifted range. Okay, their social style can vary tremendously from being aloof, even to the point of not hardly noticing people in the same room, passive where they kind of look around but don't actively engage. And yet many other people with autism are attentive to who's in the room and what's going on and may initiate in many different kinds of ways, but it's sometimes a bit off how they're presenting, what they're saying. Something might be off in their nonverbal communication. And it's not necessarily evident from that first interaction. It really depends. Okay. Communication styles, as I mentioned, we have all levels of language, from nonverbal to minimally verbal to very verbal. But again, remember, all people with autism have impairment in social communication. So that's how they use their skills to communicate. So some people with autism have a lot of language, will know lots of facts and figures about an area of interest, but won't necessarily be very good at two-way reciprocal communication. And they may not use nonverbal communication well, etc. Motor skills, we see a big range, awkward to agile fine motor skills. Motor skills, again, gross motor skills, they may be uncoordinated Two, very coordinated. We'll talk about some of the strengths with that and some of the challenges as well. And their behavior can be dysregulated or regulated, although most people with autism have some problems with emotional regulation skills. Now, the diagnostic picture just talks about those two main areas, but we know from research and clinical experience that there's a host of different challenges students with autism may have in school. For the most part, no matter how high the individual's IQ or how impressive their verbal skills may appear, most people with autism have a poor understanding of what the teacher expects of them, what behaviors they should be doing, what behaviors they shouldn't be doing, how to know that, especially if it's not spelled out. Most people with autism do desire friendships. However, they have limited skills to develop ongoing and meaningful friendships. Most people with autism have tremendous difficulty seeing things from someone else's perspective. So especially if there's a behavioral incident, it's pretty common for teachers or even parents in the home setting to want the person to apologize. But actually for people with autism, they're going to really need instruction to begin to understand another person's perspective. This can happen over time, but it's not automatic. The vast majority of people with autism have some sort of co-occurring condition. Two of the most common co-occurring conditions are anxiety and depression. It's also fairly common for some people to have co-occurring ADHD, as well as we have a higher co-occurrence of epilepsy with autism, but this tends to be more so with people with autism that have intellectual disability. We have some comorbidity with obsessive compulsive disorder, but overall, I would say anxiety and depression and probably ADHD are the most common co-occurring. But the ways that these manifest themselves can be somewhat deceiving. So most people with autism don't use nonverbal communication very well to communicate, and they may not even use their tone of voice very well to communicate from time to time. So even mental health professionals, if they don't have a lot of expertise in autism, may fail to recognize the level of depression that an individual has or the level of their anxiety. By the time the person is demonstrating the commonly occurring symptoms that we expect for people not on the autism spectrum, it means their anxiety or depression is really, really high. People with autism have a tremendous amount of stress in coping with change. Their neurology is such that change creates increased anxiety, and they have a lot of difficulty being flexible. Most people with autism have a poor understanding of their own emotions, as well as the emotional state of others. And this requires lots of instruction to get better at this. A lot of people with autism have slow processing speed. So that means it's going to take them time to listen to what a teacher is instructing them in class and then act upon it or comprehend it. It also means they're probably slow in producing work and can produce less work in a limited time frame than their non-autistic peers. We often see poor handwriting. That's very, very common. Many people with autism prefer and continue to use printing rather than becoming fluent in cursive. Even if their handwriting is not particularly difficult to write, their hand becomes fatigued the more they have to write. We also see commonly poor fine motor skills. So this might mean they're slower to learn to zip up their jacket or to button buttons. They may have trouble cutting with scissors. Um, these kinds of fine motor tasks and other kind of fine motor tasks, such as opening a small container, might be difficult for some people with autism as well. The poor gross motor skills, I think, are most evident when we talk about sports involving paying attention to multiple players. So typically, people with autism are not very good at games like basketball. And if they're going to be performing optimally in terms of their gross motor skills, they may do best with more individualized sports. So taekwondo, individual walking, individual running, swimming, um, or at most a two-player game like tennis rather than a multiplayer game such as basketball. Okay. So all these sensory symptoms that we've actually known for quite a few years are that affect people with autism are now included under restricted and repetitive behaviors. So sensory symptoms, so visual. So certain kind of visual things are calming. Certain visual things may be overwhelming. Um, some people with autism can see the flickering in fluorescent lights. People with autism also can have very sensitive hearing, so it's not just loud sounds like fire drills. Even soft sounds like the air conditioner in the room or the hum of a computer can be quite distracting for them as well. People with autism are known to have a keen sense of smell. So perfumes may bother them tremendously. The smells of certain foods, other kinds of smells, they may detect that your eye might not be able to detect what it is. I have a son with autism, and he could actually smell the milk going bad before I could really smell it going bad. Like he really could pick up on those things much more readily. And people with autism are very sensitive in terms of the taste of items. So you probably know that many young kids with autism in particular are very, very picky eaters. But even as people become teenagers and adults, they may still have a fairly limited palate and prefer some foods much more than others. Even, for example, the brand of spaghetti sauce that the mother uses might bother them. So even if they like spaghetti at home, it doesn't mean they're going to, find the spaghetti in the school cafeteria um, okay for them to eat. That's why you'll sometimes see people, parents sending the same lunch or limited lunch choices because they know their child's a picky eater. That's also why you might have students that the smells in the cafeteria bother them. So one accommodation might be leaving the cafeteria early so they can get away from the smells. Maybe it's the smells, maybe it's the sounds, maybe it's the social demands of that environment. There are many reasons why we might have them leave. Their sense of balance can also be quite different. Some seem to have a very good sense of balance, where others are aware of their body kind of awkwardness and they're fearful. So, for example, we're located in Florida, and a common field trip is to climb up the stairs of a lighthouse. And I've had several clients with autism who have been very scared to climb up it. And this is something to think about on field trips or ask the family about, or maybe the person can stay, not have to climb up and can stay down doing some alternative activity till the class climbs back down. I also had a student that was going on a scouting event and was very, very afraid of getting in a canoe where the canoe kind of moves, and they felt so uncomfortable with the balance. They felt like they were going to fall off. So again, we had to really steady the canoe for the student to get on the canoe and be okay. Or sometimes we have to, again, weigh the pros and cons of that experience and maybe accommodate since their sensory system's different. Proprioception is an awareness of your body in space. So that's why you'll sometimes poor proprioception would account for things like people with autism bumping into someone or running over someone's possessions without realizing that they're that close to the other person or that close to the objects. I once saw this in an airport with a man with autism who, how the aisles between the waiting rooms in airports are fairly narrow. So if there are people sitting on both sides, this young man, I think, couldn't tell if he needed to ask someone to move their belongings. He literally would just go on one side and kind of keep hitting things because he didn't even realize that there wasn't enough space. And people were very irritated with him. It's just a part of his his neurological sensory system, how he perceived things. Interoception is an understanding of the signals inside one's body. So this would include things like knowing when you have to go to the bathroom. So sometimes in school, by the time a student realizes they need to go to the bathroom, it's almost an emergency. So I would be inclined to tell teachers not to ask them to wait because we don't want them to be embarrassed by an accident. And they may have only realized at the point where it's literally like a bathroom emergency. Other inside body signals would be understanding when they're not feeling well, understanding when they're hungry, when they're full, when they're thirsty, when they're tired. Okay. And these interoception skills, there's been some research done on this, and it looks like some of those interoception skills are actually, in some ways, prerequisite skills for really understanding emotions, not necessarily being able to give a definition of an emotion like happy or what makes someone happy, but to really understand, for the person with autism to understand what their body feels like when they're happy or what their body feels like when they're anxious, which is part of the way we were able to tell those emotions. Okay, so I think some intervention practices are focusing on building interoception skills. Kelly Mahler is a well-known occupational therapist who's written a lot about interoception. She has a curriculum for interoception, and she sees it as a precursor for that kind of emotional learning. So people with autism can also be hyper or hyposensitive to different sensory input. Let's take pain, for example. One child might be hypersensitive. So when that child falls down on the playground, and maybe scrapes their knee a little bit, they might be hysterical about the scraped knee because they perceive it. They either experience it as tremendous pain or they have like a psychological interpretation if there's any blood running, that it's very dangerous for blood to leave your body, so that might contribute to a highly emotional response as well. We don't really know, but we're learning from people with autism can explain how they experience these things. On the other hand, you have people who are hyposensitive. So that's why some people with autism, when they're hurt, even if they're very significantly hurt, they may not be able to report that. And when you think about it, our pain sensations are kind of warning signals for us about our own body. So, if, for example, a student does experience some sort of physical thing, even if they're not really complaining about it, I think the adults around them, so meaning school personnel, need to think, could this be serious? I can't necessarily rely on this student's ability to indicate that. Even if they have verbal language, they may not really be able to tell so much. Some people really crave sensory input, and other people avoid sensory input. And this can happen again at different times. So when we think about craving input, we're thinking about those kids where maybe with the help of an occupational therapist or someone who maybe a school one or maybe an outside OT may help provide a sensory diet that can be done in a classroom to help them regulate their sensory input and their emotions. And other people are very sensory avoiding. So sensory symptoms are a big aspect that create challenges for, I would say, around at least 90% of people with autism, maybe not all, but many. Okay. And we see a variety of different kinds of academic challenges. Again, for those highly verbose people with autism, we may see that they have their word recall skills are pretty good, but it masks those reading comprehension challenges. Okay, so we also see that in general, people with autism have good long-term rote memories and maybe even short-term memorized tasks. They may memorize a section from a textbook, for example, and they may be able to repeat that or spill that, kind of write that down, but it doesn't necessarily mean that they understand conceptually the tasks that, require an in-depth understanding of knowledge. So we have to kind of look at that. Also keep in mind, because we're going to have a range in schools of students with autism, that reading disabilities like dyslexia are language-based learning disabilities. So probably we have a disproportionate number of people with autism that also have dyslexia. We have a lot of students with autism who are whole word readers, and their phonemic awareness is not necessarily as good. And of course, you can have any kind of specific learning disability along with autism. So we can't assume everything's autism. And so when we're doing that, updated psychological testing, which I know the team has to at least consider every 3 years, what if we really are surprised at how the student's doing? Another reason to look at that might be because we need to determine if there's something underlying in a specific academic area, or maybe we want to look at that social emotional learning and get a better sense if this person's experiencing higher anxiety, more distress, or whatever. So there's a number of reasons that we want to keep our eye on this and look at this because it helps in terms of intervention, whether it's extra help at school or informing parents and them able to get outside help outside of the school setting. Okay. As I mentioned, a vast majority of people with high percentage of people with autism also have ADHD. Even without having ADHD, they tend to have poor executive functioning. And executive functioning really covers a host of different skills. Prioritizing, what do I do first? Planning, how do I know the steps in getting ready to do an assignment? Or do I know the steps for completing a book report or a science project? Problem solving, do I only look to solve problems one way? A lot of people with autism get stuck that way, and they have trouble kind of getting out of that rigid way of thinking and seeing another avenue, another way to approach a problem. Many people with autism have trouble shifting attention. So that means if the student's engrossed in reading something or another task, and the teacher starts talking to the group as a whole, they may not hear that and shift their attention back to the teacher. We might have to actually call their name. Again, try to do that in a positive manner. We might need to go over by their desk and kind of, a little bit closer, prompt them that, listen, we're not looking at those papers right now. Let's pay attention up at the front of the room. They also have trouble with things like multitasking. organizing their papers, which means I think from the very earliest age, we want to teach students a system for getting papers back to and from school in some order. So to me, that means in a folder with papers straight, not crumbled up inside a folder, and establishing as early as preschool or kindergarten or first grade, working on the skill of just getting that folder turned into mom when they get home from school, going back in the backpack and going back to school the next day or going back to the teacher, okay? And then as students get into higher grades, we want to consider how to help them organize the papers for a specific class. And often students with autism also need guidance on when to throw away papers, when are they no longer going to be needed. They tend to hang on to everything because they're not sure if it's going to be needed in the future. So it's kind of a big deal as well. Okay. Most people with autism have special interests. Their special interests are very, very motivating. And even though people with autism might be motivated to do tasks to please their parents or to please their teacher or school personnel, I would say very often we find they need external motivation. So it's important in schools, and I would say all years that kids are in school, not just when they're young children in school, this includes high schoolers, that we need to think about what we're using as a motivation for them. Keep in mind that the timing of reinforcement needs to be close enough to the behavior for that reinforcement to have a greater likelihood of being successful. Okay, so for some kids, that reinforcement needs to be after the specific activity. If they have a token board where they're earning tokens, maybe as soon as their token board's full, maybe that's after breakfast they need, not breakfast, after the morning activities, they might need the reinforcing activity or whatever. I have very rarely seen, even for older students and students with autism that have many, many skills, I've rarely seen that reinforcement at the end of the week is a close enough time between positive behaviors and reinforcement. I mean, that can be a goal, but I usually find that we're expecting them to be able to delay the gratification for a much longer period than their coping skills might really be at any given point in time. Okay. Now we're going to talk a little about some of the strategies that, again, require that administrative support. So I think we have to recognize that school is a really tough environment for students with autism. They're hit with hour after hour of different demands, social demands, sensory overload, interacting with lots of different people who they don't read well, they don't necessarily have a group of friends. They are often subjected to bullying. We'll be talking about that in a few minutes. And we want to look at really as many ways as possible building in social supports. So that might be that the front office lady has an affinity for Miguel, who comes in through the front office every day to go to school. And she knows that, she knows Miguel and she always greets him. Miguel, so nice to see you. Hope you have a great day. And even that kind of exchange that's positive with an adult can provide some emotional social support for an individual. I once had a student in middle school who loved vacuuming. And one of the people that the administration kind of built into place was if he was having a particularly good day or handled the situation well, he was allowed to go seek out the janitor. It was okay with school personnel for the janitor to take several minutes to talk to the student about the most recent movie he saw or something he did over the weekend. And in this particular case, the student liked to vacuum, so then we might even find an opportunity for him to vacuum for 5 minutes and then be, finish up with the janitor and pop back to class. We want to look for creative opportunities to create these kinds of supports. Home base. Home base is a place where a student could go to regroup when they're becoming overly aroused or beginning to be agitated. We want to really catch it as early as possible because it's easier to intervene the earlier in the cycle. Okay, the sooner that we realize the student's getting upset, and we might want to have a home base for them. If the child's behavior is not overly disruptive, and it's young students, sometimes we create a home base just in the back of the room with the beanbag chair and some calming activities. For some of our kids, that might be a favorite book. It might be a fidget. It might be some paper and markers to draw with. Again, individualized, okay? Where we would prompt them to go to take a little break. And then once they've calmed down a bit, bring them back and re-engage them in the activity. Home base can also be scheduled throughout the day, so it can be scheduled as a homeroom to get the student organized first thing in the morning, calm them down from the bus ride if the bus ride's disruptive. It's also a place that sometimes you can create a home-based class after a particularly stressful activity. Keep in mind for our kids, unstructured times tend to be problem times. So that means that recess is not always a favorite time. Lunch is often a stressful time. Assemblies can be stressful. Language arts, if it's requiring a lot of writing or really any academic where the content's hard for them. It might be, they might have a particularly difficult time after a class with a particular teacher, so we might want to schedule some home-based time. We've had home-based be in the library with the librarian to do some calming things or some instruction. We want it to not be in the front office, which is busy and lots of people coming and going, okay? If we're having them leave the classroom, we probably want to have a couple of designated people who could meet the student in whatever area we determine is going to be appropriate in the school. Because we don't want the student going from one place to another place to look. We want to have some kind of a system, and maybe through the intercom or the walkie-talkie system that people have in schools to call a certain person to it. That could be somebody from your special ed department. That could be a school administrator that knows the student well. It could be the school counselor. It's usually a good idea to have at least 2 or 3 people designated as possible safe persons, just because a given person at the school might be out of the building or not able to meet at the time that you need it. And we also strongly encourage for school administrators to give some real thought to matching their teacher's style with the student. Sometimes we think the student with autism needs structure, structure, structure. And although they do need structure, they also really need a teacher who can be flexible. Because remember, our students with autism are not flexible. So we need a teacher who can adapt things as they go and can adjust things when the student's having a difficult time. If you have a teacher in your school who's been, or a staff member who's been particularly sensitive, worked well with that particular student, get their input and helping you decide on what teacher to maybe match the student with. And sometimes we find out that we did our best, but it's not working out. And it's worth it to come back as a team and discuss who might be a better match and switch the student for that one class with another teacher that might be a better match. These are things well worth considering. Okay. As we mentioned, students with autism don't do well when there's change. So until I've gotten to the point, meaning for some kids, by the time they're in high school, and maybe for others even earlier, they can adjust to the fact that the substitute teacher does things in the wrong order, not the same way that the regular teacher does it, et cetera. And they can handle being the substitute teacher, but for a lot of kids, it's well worth it to make alternative arrangements. So whether that's, say your student is in a resource room and in general ed, they split their time during the day. Maybe if the general ed teacher's out, they can stay with the resource room teacher or vice versa. Okay. Maybe the student is both gifted eligible and is in general ed and some ESE. For some students, we've had them, particularly when it's a pull-out gifted program, we've had them in the pull-out gifted program, but then we've had them be the gifted teacher's assistant when the general ed teacher is out, or something like this. Okay, think about it. We're going to talk about bullying in a minute, but important to protect the student from problem peers. If you know of a problem peer, seat them far away from that peer. Again, might need to make sure that student is not sitting with them in the lunchroom. You probably need to monitor for bullying, find out where it's been occurring, and create some safeguards. If it's happened in the bathroom, we might need to escort the student to the bathroom or have someone who escorts them at non-change times to really keep them away from students that we know are bullying them. Bullies know what students are reactive, and unfortunately, our kids tend to be reactive. They tend to be awkward, and all too often, they are the subjects of bullying. Okay. Students with autism are pretty well spent at the end of the school day. Plus, as I mentioned, many have poor handwriting, in which case I recommend keyboarding as early as 3rd grade. Let's get them keyboarding. But also, if they've mastered content, only send the homework that's essential for them to master a concept. Try to either eliminate homework if the parent's describing them as completely overwhelmed at the end of the day, or reduce homework to imaginable amount, keeping in mind their processing speed and how long it may take them to complete homework, as well as the fact that they probably need a considerable amount of downtime to de-stress from the school day. Okay. And then we think of most students with autism as finding visual supports helpful, that pure auditory instruction is maybe difficult to remember for a long period of time. So we want to use visual supports. I always say the visual supports change as we get older. We don't knock out our visual supports. Most of us use a calendar. Most of us have a way to take notes somewhere. I have everything on my calendar to remind me of errands to do after work, to remind me of things to finish during the workday, etc. I use all kinds of visual supports. The most important thing being there's a visual support is one that the student can understand. So you might need to augment it with pictures or photographs. There's nothing wrong with that. And for other students, just written out details can be fine. But don't hesitate, continue using those visual supports throughout. Okay. And understanding people with autism really takes experience. Just because you've had experience with a few people with autism doesn't mean you're not going to encounter somebody else with autism who presents very differently. So especially if you find you have new staff or they've gotten a new student who's particularly challenging, really think about having ongoing training, because you can't necessarily front load it all in an 8-hour training. Sometimes they need to get to know students and then have more training because other little pieces are going to resonate. Or maybe you want a Q&A with the trainer, not just a didactic training. Okay, and keep in mind, for those of you in Florida, okay, our center serves South Florida, Miami, Broward, and the Keys, but there's other card centers that provide this kind of training and can do Q&A and consultations at no cost. Okay, but feel free to seek those out, because I think it's a process to really better understand people with autism. It happens over time, and as you get to know more and more students. Okay, bullying. I mentioned a very high percentage of students with autism report having been bullied. Some don't even know if they're being bullied, but this is some research on where most bullying occurs. So most bullying actually occurs in the hallways or in the classroom. Okay. And that when you hear of bullying, whether the student may not bring it up, okay, the student might be afraid to bring it up. Some kids don't even know if they're being bullied. So if the parent brings to you that they think their child's being bullied, or if you have highly verbal children, ask specific questions. These are examples taken from a bullying interview developed by Rebecca Heinrich. You might have to ask them specific questions. These are just some of the questions. And her interview is particularly good, again, for those verbal students with autism. I found that by late elementary school, fourth, fifth grade and above, if they're really, really highly verbal, that if you really walk them through these very specific questions, they can tell you, they can help identify where, when, who, and it can really allow you to put some strategies in place. And now there's actually a lot of laws that really make it the responsibility of schools to protect students from bullying. And so keep this in mind, because it's very, very devastating. It's not just devastating in the short term, it's really devastating to their emotional well-being over their lifespan. Okay. We know people with autism often have challenging behavior. Okay. One of the problems with most of the discipline procedures that we use is that they take away things. They don't teach new skills. So most of the problem behaviors happen because people with autism don't have alternative, more appropriate coping skills or more appropriate behaviors to put into place. And most of the time, when you have a behavior and the child has autism, most of the time it's going to be related to their autism, which is again why I think that ongoing training is essential. If you've only had kids with severe autism in your school, and then you get some kids with autism level 1 in your school, those kids' presentations are going to be very, very different. And you're going to have to help your team understand the different presentation and those challenges that are taking place. Okay. And even if they can state the rule, it's really important to remember that even though they can state it because they've memorized it, they've heard it, it doesn't mean they can necessarily follow through on it. Okay. They may not know how to follow through on it. They may not be able to, they have to learn the strategy, and then they have to be able to implement it at those times when they're becoming upset. And for most of our kids, that takes a lot of practice. It takes a lot of practice. So keep that in mind when you're dealing with behavioral challenges. Okay. Some of the strategies that can really help foster positive school-family relationships. I'm just going to go over a couple of these right now. First of all, really encourage your staff to listen with empathy and to fully hear parents' concerns without becoming defensive. Listening, feeling heard, so really, really communicate with families regularly about student successes. Okay. I encourage administrators to do that, as well as anyone who has contact with the student. Even little successes that show that you appreciate the student. That's so helpful. And when you do have to address a problem that you feel is necessary to communicate with the parent, have your staff or keep in mind to use the sandwich communication. So start with something positive, then discuss what you need to that's not so positive, and try to end with something positive. And also keep in mind if it's really try to evaluate what's necessary sharing that's not positive, because in many, many instances, the parent's very aware of the student's challenging behaviors, and they don't have a magic answer for it either. So, when they're contacted about behaviors that they can't do anything about, it's very frustrating because they feel like in school, schools where the professionals are working and they don't necessarily have a solution. So really, really weigh what problem behaviors are worth communicating with a parent about, and have as many positive communications about positive things about that student as you can have. It's also helpful to think about appointing a primary contact for a family. So sometimes parents of kids with autism um, take up an inordinate amount of time. They're used to, remember when parents have a child with autism, sometimes it's taken them a long time before they got a diagnosis. Their child's often misunderstood. Um, they're used to having to really strongly advocate. So you might want to either relieve a staff member, like relieve the teacher from certain duties so they have more time in their school day to actually be talking to parents uninterrupted in a private place, which that's not so easy in schools. Or sometimes, particularly in middle school or high school, if the students having classes with a number of different teachers, it's really, really important to consider having a primary contact for the family so the family's not having to email every single teacher to find out what the homework was or to find out how the student was doing in that class. That's where, again, you might have, a school counselor, a special ed coordinator, another person touching base with all the teachers and then communicating regularly with that parent. So it's very, very, very helpful because you want to help manage the teacher stress, because kids with autism are stressful and the parents can be stressful as well. We know that. And then we've got some different references for you. I hope this has been helpful. Have a good day.